The floor is yours, Claudia.
Thank you very much, and welcome to everyone. I'm Claudia Marinetti. I am the Director of Mental Health Europe, and I will be the chair for today's event. I am pleased to see that we have already over 100 people online, and the numbers are growing. I think we had around 200 people registered for this event, which means that clearly the topic is of interest and very relevant. We know that for a comprehensive approach to mental health, we need to have a clear understanding of those that are the relationship between the wider determinants of mental health. And it is very important to shift away the focus from the individual towards the context in which people live. There is growing evidence of the associations, in particular between mental health and environment. So the objective of today's webinar is to support an understanding of the relationship between environment and mental health, both in terms of risk factors and also protective factors. Today we will briefly hear from DG Santé, who will give an overview and of the background of today's event. Then WHO will set the scene, explaining the impact of climate change on mental health, including the work of the WHO Pan-European Mental Health Coalition in emergency preparedness, response and recovery. We will then have two practical experiences building on WHO's input from the perspective of health professionals and highlighting their need for climate literacy, and of frontline responders. The Red Cross will talk about mental health and psychosocial support during any occasion of natural hazards. We will then move to environment as a protective factor and showcase a promising practice about supporting mental health and well-being through nature-based solutions. A representative of the DG Klima will then give their comments before we close the event. Through the event, we will have 2 moments of question and answers. I would like to encourage you to type already in the chat as we go any question that you might have. And then before, let's say, we will have a first moment of question and answers after the first block, which focuses on the risk factors, and another moment after the second block, which focuses on protective factors. Depending on time, we might also be able to give the floor to some of you for oral questions. And as it was explained just before, you will need to raise your hand. Without further ado, I would like to give the floor to Stefan Kranen from DG Santé. Stefan, the floor is yours.
Thank you very much for the invitation to speak at the second webinar already of the thematic network. I just wanted to give a few slides on the purpose of this thematic network and how it can help the Commission. Next slide, please. Through these thematic networks, the Commission wishes to encourage cooperation and information sharing between civil society stakeholders on specific health-related issues. And we also wish to encourage the development of a number of joint initiatives that these organizations can develop in order to help to progress the issue. The purpose of a thematic network is then in the end to develop a number of joint initiatives, and these will be then listed in a joint statement. And I believe the joint statement for this thematic network is will be presented in April. It will summarize the common position of the members of the thematic network. And we have to make sure that this will not be a wish list of actions that the European Commission or the member states need to implement. The joint statement is rather meant as actions that the members of the thematic network can commit to themselves and actions that they will take forward together to make a big impact. Next slide, please. So this thematic network on mental health in all policies comes very timely. we can see that from this slide. I'm sure you're aware that President von der Leyen announced a new initiative on mental health last September in her State of the Union speech. And following that announcement, the relevant Commission services have started to put work into action to develop this new initiative, a comprehensive approach to mental health. That's what we're aiming at. But we can't do this, of course, without the support from the member states, from stakeholders, and from citizens. So that's why we've set up a number of targeted webinars with the member states, with stakeholders, and there's also the call for evidence on mental health, which we launched last month, which closed last week. And this will all provide us with feedback and input, which we can take forward in the Commission communication on a comprehensive approach to health. Let me also take this opportunity to announce a new stakeholder webinar that we will organize next week on the 2nd of March in the afternoon. So this is yet another occasion for us to give an update where we stand with the development of the new initiative, but also to hear from you, from stakeholders, what you consider important to be included. And then the adoption of this exercise, of this communication, is then foreseen at the beginning of June, the 7th of June, sorry. Next slide, please. As I said, this thematic network comes very timely, and it helps us to gather to pick the brains of the experts that are in that are active all over Europe. The thematic network can help us to collect your experiences, your information that you have, any best practices that you would share with us. So especially also on environmental and climate determinants, as this meeting will focus on that. The thematic network also, like I said, helps to reinforce the cooperation between the key stakeholders in this area. And focus should, as we also try to do in our policy making, should be on helping vulnerable groups and socio-economic disadvantaged groups. So that would be appreciated if we can help to if this network can help to further reduce these health inequalities that unfortunately still exist in Europe. With that, I conclude my presentation. I give the floor back to Claudia, and I look forward to hear the presentations and especially the discussions today. Thank you very much.
Thank you very much, Stefan. And I would like then to directly pass to our next speaker, Anna Tijerino, Technical Officer, Mental Health Flagship WHO Europe, who will set the scene and talk about mental health impact of climate change. Anna, the floor is yours.
Thank you very much, Claudia, and good morning to everyone. A real pleasure to be with you today. I will try to guide you through this presentation on a policy brief that was launched last year in June, was launched by WHO, and it's related to all these consequences, direct and indirect, of climate change in mental health. Checking my watch, so I will try to get the time correct to go through all these slides with you. We have noticed, and something that is undeniable, that in the last 5 decades, between 1970s and 2020, climate-related hazards have increased. And as you can see on this graph, from 2003, 50% of all the events are occurring in these last 2 decades, affecting more than 5 billion people in total. And we need to be concerned about mental health in the context of climate change, because this exacerbates many of those social and environmental risk factors for mental health. I mean, the development of new mental health conditions, but also worsening situation for people living already with those conditions. I might be preaching here to the converters already, but I think it's worth to set the scenes and remind us all that mental health conditions still represent a significant burden worldwide. Even if these numbers are made for global numbers, we still see that in the European Union and Europe region, still not so different. We still have very little investment in mental health. We still have a big proportion of people affected by mental health conditions. We still have a huge impact on annual cost, almost $1 trillion of US dollars due to common mental disorders untreated, like depression and anxiety. And we continue facing challenges and shortages of staff and mental health workers and professionals be able to support this huge burden. So even if the European region stands better than other regions in the world, we still are far away from the media that we need to reach. So we still have struggling with those understanding impacts of climate change on mental health, but we believe that with the current knowledge, it's already sufficient to act. So this is a topic that has been emerging since 2007, more or less, and it's more and more connected with what in WHO and in the Interagency Standing Committee, it's called of MHPSS. So we will hear a little bit more on that later on another presentation. So it has been more or less framed on this response for emergency disaster management. But today we have strong arguments to make that we need to expand this focus of the impact of climate change on mental health beyond those frameworks alone of emergency response. So a few key operational definitions. So for example, the Intergovernmental Panel on Climate Change defines climate change as a change in the state of the climate that can be identified by changes in the mean or virality of its properties. Also, WHO defines mental health as a state of well-being and not only in the absence of a symptom. And of course, another definition that we'll be using very often and probably in an acronymous way is MHPSS, what is mental health and psychosocial support, which is used to describe any type of local or outside support that aims to protect or promote psychosocial well-being and or to prevent or treat mental disorder. It's true that these are complementary approaches in providing appropriate support, and this is why it's not only about a clinical one, but a synergy of different support mechanisms for people during emergencies, conflicts, and distressful situations. So this might be a very complicated graph. I hope you will have the time later. I will leave you the link to review this policy brief on the impact of climate change on mental health. But just to show you that there are different pathways by which climate change can affect people's mental health and psychosocial well-being, and there are multiple ones. And we can see that already a number of vulnerability factors, inequalities, makes that this impact of climate change and the different hazards of climate change might expose people even to a more difficult situation. So one of these environmental, social, and economical determinants for mental health might include air quality, water quantity and quality, food security and safety, income and livelihoods, ecosystem changes. So one example of that is, for example, in some air pollution, for example, during the periods of high temperature that can cause respiratory disease, that increase the demand for healthcare services, reduce mobility of people and the capacity to work, and therefore can lead to mental health consequences. Probably we can see that even more clearly on prolonged drought. So we have significantly disrupt agricultural production, and that leads to loss of livelihood and how people can continue their daily life on that. And this for affecting social determinants, increasing poverty, and therefore a very high risk factor to develop common mental disorders. Climate change, we know, might also lead to increased conflict or aggregate conflict dynamics, particularly in regions dependent on agriculture, and to forced migration. So therefore, we are seeing this affecting different particular moments of the person's life and in different ways. Of course, certain groups might also be disproportionately at risk due to climate change. It's true that vulnerability is context dependent, and understanding who is vulnerable and in what ways requires targeted assessments and of course to identify which are those contextual factors. And of course, not any single factor might necessarily determine vulnerability. But however, we see that when many of these factors are confined and interacting, then the effects are multiple. There's another thing that is worth mentioning today with you, and is that we do have some terms that we need today to be able to respond to those, and they are more and more commonly used in the literature of climate change and the effects of mental health. We see as part of our work at WHO that we need to work with you, with experts, to ensure that these terms are properly defined and properly researched, but we cannot ignore them today. So we'll see them as climate change anxiety, solastalgia, eco-anxiety, environmental distress, ecological grief, climate change-related distress, psychological distress. So we need to be very cautious is that we need to be away from where we're pathologizing reactions, normal reactions to abnormal events, but also to avoid using them in a way that we might overly medicalize. So we still have a way to go on understanding them, and probably we need to still collaborate a lot with experts and of course with you as stakeholders to better understand how to use these terms and also how to better qualify them. I once was with a communication advisor who told me that usually people in the presentations will remember the first 2 minutes and the last 3 minutes. But probably if I need to call your attention right now, this is probably one of the things I would like you to remember of these presentations. What are those approaches to address the mental health and psychosocial impacts of climate change, and where are those recommendations from this policy brief? So first of all, integrate MHPSS with climate action to better prepare and respond for climate crisis. Integrate MHPSS within policies and programs dealing with climate change and health. Continue building on global commitments. We should not leave that battle away. Implement multisectoral and community-based approaches to reduce vulnerabilities and address the mental health and psychosocial impacts of climate change. And I think it should not be the last, but one of the main priorities is that we need to continue addressing those large gaps in terms of funding and access to services in terms of what is meant for mental health burden within the population. For this presentation, I also wanted to go with you with what today in the in WHO Europe, we are working as an ambition to improve mental health in the region. In 2021, it was approved the European Framework for Action on Mental Health. It has these 3 main pillars, which is moving towards universal health coverage, so making mental health accessible for everyone, protecting people better against emergencies, integrating mental health into the emergencies response, recovery, and preparedness, and of course, ensuring healthy life and well-being for all at all ages. And this is promotion and prevention of mental health over the life course, from children to older adults, and including also at the workplace. To be able to materialize this framework for action, the Pan-European Mental Health Coalition was launched on September 2021. 2 weeks later, the approval of the Framework for Action. And this coalition, it's working on 6 main package aligned with many of stakeholders that are supported members of this coalition. The idea is to bring these 6 working packages and have products that are able to be implemented in the different countries of the region. Those 6 packages are mental health leadership, mental health service transformation, mental health in the workplace, mental health in older adults, mental health of children and youth, and of course, mental health in emergencies. And this is where for us also is essential to address those impacts of climate change. So how to integrate mental health and climate change actions? As I said, we understand that today we still need to work on the leadership and proper governance on how to do that. We need to continue working with the health workforce and not only with mental health workforce. We need to understand better the concepts of vulnerability, capacity, and adaptation of the population to those changes. Integrated monitoring, risk monitoring, but of course the early warning on when these impacts and how to better address them. We need to invest on climate and health research. We still, as I said, it's kind of new on this area. It has brought the attention, but we need to invest more on research. We need to invest more on sustainable technologies and infrastructure. We need to integrate more mental health also in the management and of environmental determinants of health. And of course, on the emergency preparedness and management of those emergencies. And of course, how to integrate mental health in the climate and health financing. And I think I will stop here because I think I'm approaching my 15 minutes, if I'm not mistaken, but I will be with you for the whole webinar. So I will be very pleased to answer any questions. I can see that already the policy brief link is on the chat. So please, I advise you to read it. And it contains most of the presentation that I have already provided to you, the notes that I have provided to you. I will also update the link on the Mental Health Coalition on the chat room, so also you can also have a look on that, and we will be very glad if we have more forces joining us on tackling all these climate change hazards, but also all the needs in terms of addressing properly mental health. Thank you very much, Claudia.
Thank you very much, Anna, also for highlighting what are the pillars in terms of needed action leading to climate change, and the importance of also looking into intersectionality, so around the different vulnerabilities across the life course. I would like also to remind people, please, if you do have any questions already, put them in the chat. Select to send the question to everyone, so everyone can see what you're asking, and then at the end of this session, we will answer some or all of them. Thank you. I would like now to give the floor to Ilonka Horvat. She is senior health expert at the Austria Public Health Institute. She holds a master's degree in psychology from the University of Vienna. And in her recent work, she pays attention to the effects of climate-related exposures on health just adaptation to climate change, as well as on climate literacy for health professionals. Ilonka, the floor is yours.
Thank you, Claudia. Good morning also from my side, and I much appreciate presenting some of our approaches and of our work today. In the beginning, I would like to address one aspect Anna Maria already previously mentioned, and this is I think this is a factor that we always have to keep in mind, meaning that that there is an unequal distribution of climate change impacts among the society. The health consequences of climate changes are unevenly distributed, and there are some population groups with pre-existing health burdens who are disproportionately at risk from climate change related hazards. This is referring to the yellow bar on the graph I put in on my slide set, which is presented on the right-hand side. So mental health burdens can be a pre-existing health condition on the one hand, meaning that it is a vulnerability factor, but on the other hand, it also can be seen as an outcome of hazards, of climate change hazards, and can be therefore defined as a climate sensitive health risk. So what does this mean for health systems and mental health care professionals, actually? So I will today focus more on the climate change adaptation measures than on mitigation measures, actually. I am referring to the framework the WHO launched in 2015, and also Claudia referred to it. I think we, as a response to this mental health burdens, we need to strengthen the climate resilience of health systems, because the extent of climate-related health risks highly depends on how well health systems can promote and protect human health. And this is also a conclusion drawn by the Intergovernmental Panel on Climate Change in its sixth assessment report, which was launched last year. So the donut on the right-hand side actually illustrates the framework, the WHO framework, and all the slices illustrates the components which are needed to build climate resilient health systems. I don't want to explain all of them. I would actually pay attention to all, in particular to the red slice on health workforce. So this is actually what I'm presenting or I'm focusing on my today's presentation. We are currently working at our Competence Center on Climate and Health. We are working on a concept of health-related climate literacy for health professional, which is a building block for building capacity in the health workforce. I would just shortly describe a very technical definition of climate literacy. So climate literacy describes a person's ability to understand the essential principles of the Earth climate system. So this is more the knowledge base to understand principles of the Earth's climate system, and to know about the influence of one's own behavior on climate and vice versa, and also to recognize the direct and indirect relation or interrelations between climate and health. And then the third component is more the literacy component. There is a person need to have the ability to find, understand, evaluate, and communicate scientifically sound information on this topic, and this person or a person need to make informed and responsible decisions for themselves and others that promote and maintain health and protect the climate. And on the other hand, make informed and responsible choices for oneself and others to manage the health impacts of climate change. And this also includes the understanding of the mental health and the psychosocial impacts of climate change, in order to provide good psychosocial support to those affected. So we are convinced that that mental health care professionals can make a very valuable contribution to tackle climate-related mental health risks due to their specific role. On the one hand, they have access to diverse, vulnerable groups, which is much needed in terms of establishing a climate resilient health system. They have routine contact with client and patients, meaning that they have a client's and patient's perception on a daily basis. And they generally, we think that they have a good trusting rates in society. Mental health care professionals can contribute in two areas. On the one hand, perceiving, mitigating, and treating climate-related health and mental health problems, as well as preventing them. For example, to jointly drawing up an individual heat protection plan with a patient, and on the other hand, they can use their role of key multipliers for transformative action at the behavioral and on system level. I have one more slide. So what is needed in terms of climate literacy for health professionals? On the one hand, there's a strong need to foster climate-related professional practice by integrating health-related climate literacy in existing curricula. We think that there's a need to set up interdisciplinary trainings on climate literacy for mental health care and also healthcare professionals. There's also a need to develop capacity of to develop the capacity of healthcare workers to understand the mental health and psychosocial impacts of climate change. The second need we identify is that there is a need of establishing a pool of trainers to bring knowledge and implementation into professional practice. And thirdly, we are convinced that there's a need to share common practice and professional experience within networks and initiatives. And I just shortly want to mention that in Germany, I think most of the information provided, unfortunately, is in German only, but I think that's a very interesting German association providing a pool of information, an important SharePoint, which is Klug e.V., and there is also a network on Nurses Climate Challenge Europe, which I would like to just mention in this context. Thank you. Thank you for your attention.
Okay, thank you very much, Ilonka, for this overview. I know it is not easy such a short time to give this overview, but hopefully we will have a little bit of time to discuss some points of particular interest after our next speaker. So we have now Maria Yusbashi, who's head of the psychosocial support and protection of vulnerable groups unit in the Croatian Red Cross. She is a psychologist by profession and mental health and psychosocial support focal point for the Croatian Red Cross. She has been working in and coordinating mental health and psychosocial support response in several emergencies in Croatia. Maria, the floor is yours.
Thank you, Claudia, and hello, everyone. So today I will be speaking about mental health and psychosocial support in natural hazards in Croatia and how we actually implemented the program in earthquake that we recently have in Croatia and how the Croatian Red Cross responded in this area. So for start, just to set the scene, Croatian Red Cross response was actually around four main pillars. One of the of course main is Red Cross usually it is humanitarian aid. The second one was the restoring family links. The third one, Infoline, and finally, what I would say most important part is the mental health and psychosocial support part. Why I mentioned here all the areas where we responded is because As the colleagues already previously mentioned, we see that how important it is to have trained staff and volunteers in mental health and psychosocial support, but also what we are trying to do is to train our staff who are responding in other areas in PFA, so they could actually be our first screening point and to screen people with more difficult mental health issues after emergencies and actually point towards to them the mental MHPSS emergency response teams. As you can see here, all of these points, so human distribution points, mobile teams for humanitarian aid, RFL team in collective centers, and also Infoline, that was a huge response during the earthquake, was one of our main entry points for the MHPSS emergency teams. But along with that, we also worked in evacuation centers through mobile teams in schools, together with DRR, which is Disaster Risk Reduction Program, which was quite important. And we saw it as a very good combination of the two, so we can actually respond to the needs both in tackling climate change, but also providing support for the teachers in schools. And also what we are doing, we are working with other frontline responders, and I will talk about that a little bit in the end. So basically what we did, our MHPSS emergency response teams, we don't have them a lot, like Maria in the beginning said, so they are not, it's not a big pool, but it's a very important pool of experts. So we had PSS teams on the ground 7 days a week in the early response, so in the first 3 months of the response. And then we try to actually to put it on the local level, to train local experts, and to actually to strengthen the community to do the work after we are gone. We were covering 4 city regions, which were quite huge and very remote, so it was a big challenge for us. And approximately we had 10 emergency response MHPSS teams in rotation, coming and going in these 7 days a week work. What we actually did and what we found very important in our work in emergencies, but I would say that it's becoming more important even now, is that we should use a very proactive approach. So I don't know how much you are familiar with the Red Cross work, but we are preferring to go to the people and to be where are the people, because sometimes, at least in Croatia, it's we are trying to work with them to discuss about their needs and to be present with them. So basically what we did, we were present in the evacuation centers, and also we did a lot of work through our mobile teams in remote areas. In evacuation centers, you can see the activities that we were doing. It was both focusing on mental health, because we had a lot of people with previous mental health issues that we were also focusing on, but also with for other people. So we were supporting them in different ways, with individual psychological first aid, with social activities, but also we did a lot of referrals that were quite important in that area, and also a lot of support with administration, because sometimes it goes along with MHPSS, and it helps a lot of people if they have someone to talk about that and help them with that. And I will say also why is that important. And in remote areas, what we did mostly is individual psychological first aid. I mean, referred people a lot also for different issues that they had in their homes. Here you can see actually the impact that it had on local population. So I was saying that support with administration, which can sound a little bit out of MHPSS work, but it's quite important for us, because as you can see, we had the percentage of vulnerabilities according to our teams that were visiting remote areas, that almost 50% of people were older adults, and which is something typical photo of population in Croatia. And this is for us was quite a big challenge to reach all of them, as they were very much scattered around. But also you can see that some of and like the colleague said, the impact on the vulnerable people are actually the biggest, and it's actually shown here on the one very small area in Croatia. And to speak about further needs about for the people that they have, you can see on the other graph that around 50% of people said that they need further support in psychological first aid. So this is, I think, that speaks itself and speaks how important MHPSS is after emergencies, but also in the after phases, because those programs that we worked on in emergency phase are still lasting, and the needs, MHPSS needs, are still huge. To go back a little bit to the field coordination, what was also important for us, as like I said in the beginning, for the Red Cross, it's very important to strengthen the local community, so the local community can do a lot of work after we are gone, after the emergency teams are gone. So we connected immediately with the local medical practitioners, local psychiatric hospitals, which was also quite important, centers for social welfare, and also local NGOs and MHPSS experts that are actually goes in hand with the Red Cross and all the work that is being done in the field after that. One important information in Croatia, that Croatian Red Cross was coordinating the MHPSS cluster, and you can see here all the organizations that were actually participating, and I think it's a really good practice example for the future. And then for the end, one point that Anna Maria also mentioned, and I think it's quite important, is that usually what we forget is that MHPSS for frontline responders, the climate changes are happening, there are more hazards, and we have the same frontline responders. There's not enough time to recover from one hazard to another. There's a high turnover of the staff, probably because they are experiencing different psychosocial difficulties. And in the end, not all frontline responders are trained in self-care and emergencies. We are trying to do our best, but sometimes it's really hard when the hazards are big and it's covering big parts of the country. So that would be all from me, and thank you. If you have any kind of questions, feel free to put them in chat. Yes.
Thank you very much, and thanks also for this last message that you gave. I hope that all what we are collecting here is also going to prompt more policymaking in terms of addressing the climate change and natural hazards field, because what we should not demand is actually for people to become more resilient to whatever we throw at them. Otherwise, we risk not to actually focus and act on the social determinants and put it all on the shoulders of the individuals, and that is just not fair. And also, I mean, humans have there's only so much that you can take. So now we have some time for questions and answers. First question, I saw that there were some comments on the chat. There was one comment about the importance of focusing on children and young people, and maybe I would like to ask the speakers whether this is something that is also your experience, that this group particularly needs support, whether there is targeted action. And then there was a second question about whether, a comment saying that it would be nice to have a repository of good practices, and probably I'll ask the European Commission to answer on this. So any of the speakers so far want to take one of these two questions or comments?
Claudia, if I can make just a few comments on regarding children, adolescent, and young adults. And I think I mentioned it on the presentation. We already seen the impacts of climate change in hitting on an already high burden of mental health conditions with no being addressed. We saw on also another scientific brief who was published early last year from WHO, just COVID impact. One of the things that we were able to actually measure and following was that the most affected age population was children and adolescents. So we do know that already we have a high burden of challenges in children and adolescents. So therefore, I totally agree with the comment. There's a need to address more efforts for this population group. At WHO, we have been hearing from member states this need as a huge need to help them on how to properly address services, but also to invest in prevention and promotion of mental health with this age group. So this is also another reason why within the Pan-European Mental Health Coalition and these efforts to operationalize this framework for action in mental health within the region, we have one specific working package on mental health and well-being of children, adolescents, and young adults.
Thank you very much. Any of the other speakers want to mention something?
Yeah, I would like to raise one aspect, which is maybe does not so much refer to the climate literacy approach, but generally, I think that when you address health and climate change, I think there's a strong need to actively include the younger generations also in setting up structures and also setting up policies and so I think that climate change actually calls for action in a way that it should be cross-generational, because I think it's the younger generation who will be highly affected, also in a future perspective, by climate change hazards. And on the other hand, they at the moment are not involved in actually decisions and policy making. So so this is what I just wanted to emphasize, that I think we should find new ways of actively involving younger generations in our decision making. And we have to address their needs and bring them actively in, also with participatory approaches. Thank you.
Thank you very much, and also for bringing up the topic of co-creation. It's a really important if we want to have the buy-in and increase effectiveness of actions. I don't know if someone else wants to make a comment. Otherwise, I have two quick questions. Pretty quick questions, and one is actually for you, Ilonka, and it's in terms of capacity building, climate literacy of the mental or health workforce. Have you developed, implemented any particular trainings or enter schools training future mental health professionals? And this is one question for you, Ilonka. There is a question on how can WHO support states to integrate climate actions in their health plans? And then there is still the question of whether there is a repository of good practices around climate change and mental health.
May I respond to the first question? Okay. Actually, I have to say that our competence center on health and climate and health was just recently established. So we're working for 1 year now, and the focus on climate. We start with like one of our working focus has been on climate literacy. So what we did was we were collecting informations and approaches, and we also did a pre-selection of, for Austria, a relevant health professions. And we are now at the moment starting together with it. We have a department who is like in our institution, responsible for the development of curricula for health professionals, and we have a collaborating project, and we are currently identifying what of climate literacies, or like which aspects are already integrated in curricula, and then to define also the add-ons, what is already missing. So we are not yet, unfortunately, able to provide trainings, but I think we are on the way forward. Thank you.
Thank you very much. And Anna, do you want to very briefly, because now we're going a bit over, answer the question about how WHO could support states in integrating climate actions in their health plan?
Thank you, Claudia. I think this is one of the main aspects that we are working on the working package of integrating mental health in emergencies, preparedness, response, and recovery, because we also see emergencies and crises sometimes as an opportunity to grow. And we have seen in the past, just to make a little bit of background, how unprepared we were for the crisis of the pandemic, and even how unprepared we were with the current crisis in Ukraine and surrounding countries. So we still are far from achieving the goal of a proper integration and consideration of MHPSS as an intersectoral approach in preparedness and response in emergencies. So we are working closely with some of these countries that today are requesting our support. We are producing more and more documents on how to do this integration and how to do it as an intersectoral implementation of these not only considerations, but also how to make it as a policy and make it more live. So this also is in the coming months and in the coming years, we are working very closely also with the European Commission on these policy dialogues with each individual countries on how be able to make this a reality and see where are these gaps in terms of is it because of lack of capacity of workforce needs more training? Do we need more specific support on the policy building aspects on or how these policies need to be evidence-based in form? Do we need more support on understanding better the financing? So it's not an easy question to answer, but it's something that we want to work very closely with each of these member states. And we have seen the difference when it happens when responding to emergencies, when you have a strong system in terms of mental health integration within different sectors, how different the response is with these challenges and hazards, including climate change ones.
Thank you very much. I see that there are quite a few other questions that at the moment we're not going to be able to take them, but I'm taking note of those, and then we see whether they can be answered at a later stage. I would also like to ask you to please stick to either comments or questions related to today's webinar. I know it's tempting to do a little bit of awareness raising about our own events, but it's making it a little bit hard to navigate the thoughts and the questions. So I think we will wrap up now this question and answers session, and we will now start focusing on the protective factors of nature and the environment. Our next speaker is Nia Konila. She's National Woodlands and Nature Project Lead at Mental Health Island. And Niamh, she coordinates Woodlands for Health, a 12-week woodland-based walking program for adults availing of mental health supports and services. Her background is as an occupational therapist and outdoor yoga teacher. She will present Woodlands for Health, a program supporting mental health and well-being through woodland and nature-based solutions. Niamh, the floor is yours. We cannot hear you. I can still not hear you, and I cannot see you. Okay, now I see you. So let's see if Clémentine can help you.
Hi, can you hear me?
Yes, fantastic. Thank you.
Fantastic. Sorry, I'm not sure what happened there, but thank you for bearing with me. So
I'm not sure whether it is only me, but I cannot see Niamh again.
No, we cannot neither see her nor hear her. Maybe, Niamh, if you can turn off your camera, this may help the connection to speed up. So maybe turn it off and then try to speak.
Check for sure that everybody can hear me okay before I keep going. Okay, can't hear. Thank you so much, Sylvia. I will just one moment check in what's going on here. Can you let me know?
Yeah, now we can hear
Here
you
now.
well.
Thank you so much, Sylvia. Okay, so I'll go on. Please let me know if the sound cuts out, and I will try something else. But yes, I'm going to tell you about Woodlands for Health. Okay, I'm gonna turn off my camera. You can enjoy the slides anyway, and I'll pop back on afterwards. And on that note, the photographs that I've included throughout the presentation, most of them were taken during Woodlands for Health programs around Ireland, which I will tell you about shortly. To give you an idea of what to expect, this is what I've got in store for you over the next 14 minutes or so, I suppose, right, Claudia? I will introduce you a bit more thoroughly to myself and my role. As promised, I will tell you about Woodlands for Health, how it works, the scope of the programme at present and the outcomes. I will provide a quick overview of some of the other nature-based projects and partnerships that I am involved with. And finally, I will hand you back to our host for the subsequent question and answer session, which I hope that I might be able to contribute to. So, as I've mentioned, I'm Niamh, Ní Chnaola, a very typical Irish name, believe it or not. I'm from a small village in the most southwesterly corner of Ireland called Baltimore, the last stop on the infamous Wild Atlantic Way. As you can see in this photo here, it's very green, it's very blue. It's very unsurprising that I ended up in a job like this one. So I hold the lovely and lengthy title of National Woodlands and Nature Project Lead. Day to day, you can find me with Mental Health Ireland, but my role is also supported by Cuilta and Get Ireland Walking, and my research partners at Maynooth University, where I'm also part of the first intake of master's students in environmental psychology. My position involves coordinating the Woodlands for Health programme and also supporting and developing other nature-based mental health and wellbeing programmes and projects around Ireland. I think you'll agree that the fact that this role exists is exciting and heartening, and since coming into post last year, many people have commented on its innovation and the need for such a position, which is fantastic to hear. I know we haven't got much time together, but I'd love to know where you're dialing in from to give me an idea of your environment. So maybe you could write into the chat and I can enjoy catching up on those answers later on. I realise that if you're here, you're likely well aware of and have experienced the benefits that nature can have on our mental health and well-being. But to quickly set the context, the Yale School of the Environment refers to the growing body of research combined with an intuitive understanding. Shinrin-yoku, or forest bathing, was made part of the Japanese National Health Programme back in 1982. Friluftsliv, apologies to any Norwegians for my pronunciation, meaning open air living, was popularised in the 1850s and is considered a key contributor to physical and mental health. The Global Wellness Institute has declared that nature is at last and fast becoming the fourth pillar of health and well-being, alongside diet, exercise and sleep. And in the words of my friends at Nature and the Environment, to attain and restore health over at the University of Galway, we are part of nature and we need nature to be healthy. Here in Ireland, we have a really rich history and culture of connection to place and to the land, but I'll tell you all about that another day. As promised, I will now tell you about Woodlands for Health. It began, as many things do, with one person and a moment of inspiration. Charlie Burke is part of Cuilta's recreation team. 10 years ago, he heard about Scotland's award-winning Branching Out programme. He paid them a visit, brought the idea home to County Wicklow, and now we have Woodlands for Health, a 12-week woodland-based walking programme for adults availing of mental health services and supports, offered by national partners Quilta, Get Ireland Walking, Mental Health Ireland and Maynooth University. Each week for 12 weeks, about 15 to 20 people gather together along with walk leaders and facilitators and take a walk in the woods. And it really is that simple. Woodlands for Health is co-produced with participants' mental health in mind and is an accessible and sustainable way for people to engage with nature as part of a toolkit to support their mental health. As part of the programme, participants are supported in progressing onwards to other nature-based activities. And as you will all be aware, these things don't just happen, so this is the how. Woodlands for Health is overseen by the National Woodlands and Nature for Health and Wellbeing Steering Group, which is made up of members of our national partner organisations. This group provides structure, support and advice to programmes across the country. National working groups then focus on specific areas, programmes, evaluation and communication and marketing, and include representatives from national and local partner organisations. The programmes are implemented by local steering groups, which include representatives from the national partner organisations and other local organisations, such as the crucial referral sources, which includes but is not limited to occupational therapists, general practitioners, mental health nurses, social prescribers, and mental health associations. There are so many benefits to these partnerships, but not least of all, making sure that people are matched up with the right services and supports for them. One such example is an occupational therapist telling me that a few people who were active on her caseload see her less frequently now because they're linked in with their local mental health association, who they see in the time in between her sessions. Now, as for resources, transport is provided, as well as branded merchandise, including the lovely hats you can see modelled here. Refreshments are also taken care of, usually a hot drink and a snack, because we all know that people, and certainly Irish people, will do just about anything for a cup of tea. This past year has seen the development of a Woodlands for Health webpage, which I've linked on the first and last slides, as well as flyers, posters, referral forms, and hot off the press is our implementation guide, which is basically how to set up a Woodlands for Health programme. Of course, some of these resources have costs associated with them, as well as possibly paying walk leaders. I must mention that often these groups are led by former Quilta foresters who bring a wealth of knowledge around trees and the environment and local history, and it's a very valued element to the programme. But the costs are often shared between the local steering group partners, who are also supported in accessing local and national funding opportunities and applications. This, rather than bulk funding, helps to sustain the programmes, making them self-sufficient rather than relying on the uncertainty of national funding. Transport is undoubtedly the largest cost, and we are working on various ways to manage and reduce this, including bringing transport organisations onto the local steering groups, encouraging carpooling and supporting access via public transport, and maybe most importantly, utilising tree-filled spaces that are closer to participants' localities, which can also help with sustainability of outcomes. Such is the rate of growth and demand for this programme that I'm constantly changing this slide. It's pretty amazing that Woodlands for Health began with one pilot project in Wicklow, and now these are the figures that we're dealing with. Woodlands for Health currently exists in 22 counties of Ireland, 4 having come on board in 2022 and 1 brand new one over the last few weeks, with another 4 counties in planning stages. Across these 22 counties, there are 32 Woodlands for Health programmes, 12 of which began in 2022, and the aforementioned 1 brand new one, with another 9 in the pipeline. So we are on track to have 41 programmes across all 26 counties of the Republic of Ireland in the next number of months. Now, I know that you're a logical bunch, so you'll want to know about the evaluation and the outcomes. In the early days of Woodlands for Health back in 2014, a study was completed by the HSE and University College Dublin, Results showed a 75% increase in mood, a 66% improvement in sleep, and an 82% decline in suicidal thoughts. Interviews found benefits including reduced medication dosage and cost, decreased numbers of clinical appointments, and that some participants returned to work or education. Participants went on to form a peer-led social club who meet weekly and complete various outdoor activities. A 2020 report by Dr. Tyg McIntyre with Go Green Routes evaluated Woodlands for Health programmes across 6 counties, gathering information from 150 participants. Research found a 31% improvement in self-reported well-being and a 10.8% increase in already high nature relatedness, which, as most of you know, can in turn then lead to an increase in pro-environmental and pro-conservation behaviours. This finding is one of the many joys of having environmental psychologists on board. Often I've noticed that there can be a focus on environmental health or mental health, but not necessarily both. So this information is really valuable looking at the interconnected concept of One Health. We continue to evaluate our programme so that they can all be improved and expanded, as well as contributing to the evidence base proving the benefits of nature for mental health. Well-being and recovery too. We're currently piloting process evaluations to capture the where, the how, the what next, and the facilitator's experience, as well as outcome evaluations using a variety of methods and utilising anecdotal feedback to guide us, as we're constantly hearing of new and often unexpected benefits from smoking cessation to social connections and combating loneliness. Now, it's difficult to sum up the broad scope of my role in a single slide, but I'm nothing if not an optimist. So this is a taster of some of the other nature-based mental health and wellbeing projects and partnerships that I'm involved with. A pilot series of workshops were completed with the Irish Men's Shed Association and Sport Ireland, and a resource toolkit was created. This initiative is now being rolled out across the country. We've partnered with Parkrun to highlight the mental health benefits of participation and linking them in with Mental Health Ireland's World Mental Health Month and Hello, How Are You campaigns. The latter is coming up soon actually, so please check out hellohowareyou.info. I'll share that afterwards as well once I'm off the mic. To celebrate National Walking Day, a guided walking meditation was created and recorded, voiced by a really well-known and loved radio voice in Ireland. Anyway, that's him over on the right. Today FM's Dermot Whelan, who shared this resource with his large radio and social media audience, and current downloads are in excess of 1,300. In January, I invited an amazing group of academics, ambassadors and practitioners to participate in a new Nature for Mental Health and Wellbeing co-production group, the aim of which is to identify and fill gaps in the area of nature-based wellbeing and mental health in Ireland. But as it's brand new, we haven't got any team photos just yet. So that's it from me for now. Gurv Mila Machagaev agus Ganairi and Boherlev. Thanks a million and good luck. Or the literal translation from Irish, may the road rise up to meet you. I've included my name and my details here, and I'd love to speak to you or answer any questions that you might have.
Thank you very much, Niamh, and I've seen that there seems to be quite some interest on this. Someone was asking for a link on an evaluation report, but that can be easily provided. I'm checking here, so you're just a lot of compliments on this. I think that I like the fact that there is this strong co-creation impact. I know the Mental Health Ireland, who's one of Mental Health Europe's members, is really leading on the whole co-production and co-creation work. And also, it's quite interesting that there are so many community actors involved. Actually, one question that I had is that if someone else, another stakeholders in another country, they wanted to implement something similar, where could they start from? What are the key elements for the program to be effective?
Oh, for sure. What a great question. Well, I would love to share with you guys, like I said, it's going to be available in the next week or so, our implementation guide, which really talks through those steps of from the very beginning of who you get in contact with, what are the essential elements of the program, what then are the elements that you can kind of pick and choose from, who are the partners that you will have around the table. And I would love to speak to anybody who is interested in setting up something similar. I would be delighted, because it's a framework that can be applied in lots of different areas. So there are elements that remain consistent, which is of course really important to protect the fidelity of the program and make sure that it does what we intend it to do. But also there are elements that can be flexible so that it can be applied to different settings.
Okay, thank you very much. Is there any other question before we pass to our last speaker? Maybe something that I want to highlight. I see that Stefan Kanen from DG Santé, someone had asked about a repository of good practice. There is a best practice portal available, and I don't know if the link to this, if we are able to add it also to the flash report that will be distributed after the event, that would be great. Otherwise, if you just search for best practice portal DG Sante, it should come up. Okay, so if there are no more questions, I think that we can then move on with the last speaker in our agenda, who will give us some comments on what we have heard today, and it's Peter Loeffler from DG Klima. Peter, the floor is yours.
Many thanks, Claudia. I hope you can hear me well. Many thanks for giving me the floor at this webinar. So I work for the European Commission's Climate Action Directorate General, DG Klima, in the unit dealing with adaptation to climate change. Now, my DG is first and foremost leading an extremely intense effort to bring down Europe's greenhouse gas emissions to net zero in 2050, to slow down global warming and really prevent the worst climate scenarios. However, the last few years also have made it painfully clear that even if we achieve climate neutrality by 2050, we will have strong and persistent warming and more extreme weather events throughout this century in Europe and across the world. So adapting to climate change is not an option anymore. We need to prepare for the new reality and get to grips with it. It's a real need, and it's, by the way, also a legal obligation under European climate law, both for EU institutions and EU member states. And this is really where my unit comes into the picture, because our task is to drive and coordinate the related efforts in the Commission. Climate adaptation must involve everyone, all sectors, all levels of government. It's something that concerns all of us. And sort of in DG Klima, we therefore have engaged in health policy alongside a couple of other policies already many years ago. Because the climate crisis will come with significant challenges for our health and well-being and for our healthcare systems. And today's webinar, very thankfully, I think made a strong point that mental health is a very important dimension of this, especially for vulnerable groups. The seminar also made it clear, I think, that the growing climate change impacts on mental health are yet to be better explored and, most importantly, to be addressed in climate adaptation and health policies and all other policies in practice. The good news is, I think that we see growing awareness of this sort of nexus, this climate health nexus, and there's an increasing level of policy making and action in the field. And this is an opportunity to target also mental health impacts of climate change specifically. We've seen at the international level, for example, last year's communique of the G7 health ministers, which included a dedicated chapter with commitments to work more on climate and health, including also mental health, alongside antimicrobial resistance in global pandemics. So there is, an awareness just how important this field has become now. We are also now preparing for the conference of the health ministers of the WHO Europe region in Budapest in June this year, and where the ministers also are poised to address these issues. And we hope to see again more national commitments and actions to come out from this event. At the EU level, we've been working intensively on climate health with our colleagues from DG Santé, but also with the European Environment Agency, other Commission services, other EU agencies, and relevant international organizations, including WHO and others. And one important joint initiative coming out of this was our European Climate and Health Observatory, which is a broad partnership set up to improve our knowledge of the health effects of climate change, but also to help address them. The observatory was launched in 2021 alongside the EU strategy on adaptation to climate change, and we have last year added actually a new section on the mental health effects of climate change to the observatory portal. Interestingly also, the colleagues from Santé set up 2 years ago another thematic network under the EU Health Policy Platform called Climate Action Through Public Health Education and Training, which also published a joint statement on the subject last year. This work was led by the Association of Schools of Public Health in the European region, and their role in the process has also involved their involvement in the observatory to a point that this association is now poised to join the observatory, and I like that a lot because it will strengthen the capacity of the observatory to provide and to catalyze better training and education programs in the field. Now let me come really to the forthcoming Commission communication on a comprehensive approach to mental health. I think today's webinar has made it very clear that an approach to mental health can only be called comprehensive if it fully considers the climate dimension. And the question really is, what can we do to get better prepared, buffer the projected impacts of climate change on ourselves and on our worlds, and learn really to keep mentally well and healthy in a changing climate. And a few things that came to mind during, when listening to the interesting really presentations today. Of course, we should continue with any climate actions that benefit mental health too, like physical activity, nature and green spaces, clean air. We should prioritize sort of any climate adaptation policies and measures that have co-benefits for mental health. And that reaches from cooling of cities to disaster prevention and preparedness, to nature and restoration and improved access to nature, as Nyam presented, in her Irish example. I think Anna Tijerino made a very good point that we know enough about the impacts of climate change on mental health to be able to act. So we really need to start bracing for this new situation now. This work needs to be planned and programmed, and we know from a study from our colleagues from the EEA last year that not enough national health strategies and programs are addressing climate change impacts in general, and most likely even worse for mental health impacts. And so there is a lot of work to be done at the national level here also, better programming, better policies. I think Ilonka Horvath stressed the need to improve the climate resilience of health systems. I think this is also a very valid point. And this is, of course, this requires capacity building, education for climate health, for climate literacy. But let me add also, simple things such as climate proofing of health systems and infrastructure, so that hospitals and infrastructures don't crumble during heat waves, for example. We will also have more extreme weather conditions and events, floods, droughts, wildfires, and I think Maria Jusbasic underlined the need for better preparedness for such events, and also improve here again the mental health and psychosocial support component. So these are just a few examples and really things which I take from today's really interesting event with me. And I'm really sure that I can speak also on behalf of my colleagues from DG Santé if I say that we're very much looking forward to the next steps of the network, and to receiving the mental health in all policies joint statement in April, because this statement will have our full attention. It will come right in time to feed into the forthcoming Commission communication. It will feed into the work of our joint European Climate and Health Observatory, and it will also be on time to feed into the WHO conference on environmental health in Budapest in early June this year. So with all that said, thanks again for having had me, and I give the floor back to Claudia Marinetti. Thank you.
Thank you very much, Peter, for this overview. This is not the place, but it would be good also to discuss. It was a question that we asked WHO of what WHO could do to support the development of proper programs and plans at national level. So maybe we will look into the future also to how the Commission can support this. So thanks for this. The webinar is coming to its end. This was the second and last webinar as part of the thematic network on mental health in all policies that we organized. The recording will be available. It will be available for a short time on the health policy platform, and then we will move it permanently on Mental Health Europe's YouTube channel. The next step for us as part of the thematic network will be to draft this joint statement that Peter just mentioned. It will be made public at the beginning of April on the health policy platform, and we invite all the stakeholders to endorse it. The official launch will be on the 19th of April during a health policy platform event in Luxembourg, and it will also be possible to join the event online. It will be a hybrid event. I would like then to conclude now the event. Thanks again to all of our speakers, and also thanks to my colleagues, and in particular to Francesca Centra from Mental Health Europe, who has been working quite hard in preparing today's webinar, and she's working together with Laura Marchetti on developing our joint statement, us from Mental Health Europe, and of course all the other stakeholders that are directly involved in the development. We are looking forward to be in touch with you. As I mentioned before, I have wrote down the questions, so we see whether there is a possibility to have them answered offline. But let's keep in touch via the health policy platform, via other events and possibilities. I think that we all agree that that it is quite important to move on and to really implement action and find solutions to the current challenges around mental health, and together I think we can do it. Thank you very much and have a nice day.